My name is Frances Hayes. I am an 8-year U.S. Army veteran, and I've been in the healthcare field for about 20 years. I have my master's in public health and my bachelor's in healthcare administration. I am a veteran myself. I served 8 years in the U.S. Army. I was a 68 kilo. I was a lab tech, and I worked in the healthcare field to veterans by not only accepting TRICARE insurance, but also utilizing any VA benefits that you may have so that you have access to the healthcare services that you deserve, especially in the mental health field. Veterans face a lot of obstacles and challenges when it comes to mental health, and that a lot of them believe that if they admit that they have a mental health issue or that they're struggling with their mental health, that they're not strong enough, or that they're not good enough, or that there's something wrong with them. And oftentimes they feel alone in what it is that they're facing. Sometimes they feel, because they're alone, that someone else isn't going to understand what they're going through, but we want to help with that. Some of the stigma that veterans face when it comes to seeking help for their mental health is that if it's documented in their medical record, they're not going to be able to get a job. They may not be able to get a clearance. People are going to say that they're inefficient at their job because they're taking medication or because they're in therapy. It's not a negative thing to seek therapy. It's not a negative thing to seek medication if you're suffering from an ailment. But in the military, it's suck it up and move on. And that mentality goes with you even outside of the military. So sometimes it is just a little bit harder to get over what you've been trained to think.